Hello, and welcome to the Biomedical Systems YouTube channel. We are your one source for all clinical trial endpoints, offering the most comprehensive suite of services, including cardiac, imaging, pulmonary, eCOA, and scientific affairs. This video series is designed to better acquaint you with our subject matter experts who will be discussing the latest topics within our industry. Thank you for watching, and be sure to check back with us often.
As you know, Dave, we provide a comprehensive suite of services here at Biomedical Systems, including pulmonary services, imaging, and eCOA. What makes cardiac fundamentally different than our other services that we provide our sponsors?
Well, Masood, when you look at the other services, whether it be pulmonary, whether it be imaging, whether it be eCOA, the results of the data that we collect there are being evaluated as an efficacy endpoint. When you look at our cardiac services, typically what we're evaluating there is cardiac safety. Is the drug safe? Does it affect cardiac conduction? And no matter what the therapeutic area, when we're talking about the cardiac services, the end results and the data that we collect doesn't vary much, whether it's an oncology clinical trial or a pain clinical trial. We're looking to see if the drug has an effect on the underlying electrocardiogram. And that's the biggest difference between our cardiac services and the others that we provide.
Got it. So Dave, I'm sure you meet with many sponsors, and they would often ask, what is the main differentiator between our services here at Biomedical Systems and other core labs? How would you answer that?
Well, it is a common question, Masood, and of course, sponsors are going to look at multiple providers in order to choose the best to provide their cardiac services. I usually answer that question in two ways. The first one is revolving around our people. This company is 42 years old and has been under the same ownership since 1975. Cardiac services are in our DNA. We started as a Holter monitoring service back in 1979. So first and foremost, we've been a cardiac company since the very beginning. And then it's our people, whether it's our experienced cardiologists who overread our ECGs, our project managers who work daily with sponsors to make sure the trials are going smoothly, whether it's the engineers who've developed our proprietary software for routing ECGs and our web portal to make receiving ECG data better. Cardiac is in our DNA, and you can count on us to provide great results for your trial. The second thing I like to talk about is the fact that given that we provide multiple services, in addition to cardiac, we provide pulmonary services, imaging services, and eCOA services. So if your trial requires multiple services, it's a lot more convenient and efficient for a sponsor to choose a single provider to provide those services than it is to perhaps have three different providers, each providing a different service. So that's typically the way I respond to that question when asked by a sponsor.
Well, Dave, it was a pleasure talking to you today. Thank you very much for your time.
My pleasure too. Thanks, Masood.
Thank you. Thank you again for tuning in to this episode of Meet the SMEs with Biomedical Systems. Make sure to tune in for our future episodes, and if you would like to remain updated, please subscribe to our video channel and also check out our blog. You'll find all the information in the description, and we will see you next time.